Intimacy is a really important part of our lives, and it's a part that gets forgotten in chronic pain, so it's a really important question. And it's a multifaceted issue. Well, I'll list some things that are important to consider. And I guess the first one is the communication that you have with your partner, because things are different now. And being able to talk about it and talk about it openly is very, very important, so that you can talk about what hurts, what doesn't, talk about when is a good time and when is not a good time, and for there not to be hard feelings, but essentially to work together in a new way in terms of including intimacy in your life. Other things that are important is to consider, perhaps there are different positions, different activities that are still enjoyable, but perhaps not other things. So talking to your doctor, your physiotherapist perhaps, your psychologist, certainly your partner, exploring, knowing your own body is, again, very important. Another thing that's of great value is looking at sort of timing. So and arranging to have your intimate time together when it's a good time, not a time where you're likely to be in severe pain. And perhaps even talking to your doctor about taking your medications differently. So if, for example, you know that your intimate activities will stir up a bit of pain, taking a little bit of pain medicine in advance to kind of keep you covered may make sense, but again, that's something to talk to your doctor about. Another thing, a final thing that's really worth thinking about is really what intimacy means. I mean, is it intercourse, or is there kind of more to it? It could be the relationship building, things like holding hands or doing things together really make you feel closer, and that can be very satisfying in and of itself. So look at sort of a broad spectrum of intimacy and look at adapting that as you're adapting the other aspects of your life to your chronic pain to, again, bring the joy back into that facet of your life.